Good afternoon, ladies and gentlemen, and welcome to Siloam's FY2023 earnings webinar. We hope everyone is doing very well. My name is Willy Chandra, and in today's webinar, I'm joined by Ms. Karen Reddy, Siloam's Managing Director, Mr. Daniel Phua, Siloam's Group CFO, and Mr. Farun Kana, Siloam's Managing Director of Healthcare Business and Investments. This webinar will be delivered by Mr. Daniel Phua and followed by Ms. Karen Reddy. After the delivery, we will open up the floor for Q&A. And for participants who wants to ask questions, please use the Q&A function in your Zoom screen and feel free to ask questions during the section. Without further ado, I will pass on the floor to Pa Daniel.
Thank you, Willy. I'm very excited to be here again. Again, welcome everyone, and thank you for your continued support of Siloam. Today, I will go through briefly on the financial and operational results from Siloam for FY23. As you no doubt would have already seen, based on the result that have been released, we have continued to maintain, as we did since after the pandemic, a very stable and consistent year-on-year and Q-on-Q performances. We book full-year revenue of 8.66 trillion, representing a 17.2% increase compared to the year before. And EBITDA is booked at 2.67 trillion, representing a 34.6% improvement compared to the year before, with net profit at 1.25 trillion, a 75.5% improvement. We are thankful of the support that has been given by our patients. These results was achieved basically through continuations in continue to improve the complexities of our services, in continuing to prioritize patients' experience and patients' care, and in ensuring that we have a robust margin of costs and margins. As you can see, quarterly revenue, EBITDA, and net profit have shown consistent quarter-on-quarter improvement. And for us, that is what is most important in ensuring that whatever growth that is derived, it is sustainable. The improvement in the margin, I think, is especially encouraging. That basically shows the effort that management has put in the past to improve the payer mix, and along with to look at the opportunities for efficiency, so that we can then obviously generate additional cash that we can invest back into our services in order to continually improve our patients' experience. Now, I want to talk a little bit more about revenue. As most of you understand, in healthcare, the revenue basically is influenced by three main elements: the complexities or acuity, the throughput, and the payer mix. Let me start with complexity or acuity. As I've mentioned several times, we continue to maintain acuity and complexity that is basically leading, that is a leader in our regional peers. Average revenue per occupied bed sits at 3.3 billion, stable compared to last year's. And you will note that the average revenue per inpatient days improved from 6.3 million to 6.8 million. This was achieved by being continually focusing on what we have always called Congo, cardio, onco, neuro, gastro, and orthopedics. And I think this term has come up a few times in the past. It was Siloam strategies that we have established as part of Siloam 5.0 since 2019 to basically complement and complete the required services in the Congo area, to basically allow us to deliver procedures that is of a standard that is a worldwide quality, that basically allows us to compete with our regional peers. The intentions is that for any services that Indonesians need, we aim for them to be able to find those services in Indonesia instead of having to go abroad. Again, that has driven our continual drive to ensure that we complete our range of services in these key areas of Congo that we identify. As you can see, consistently quarter on quarter, but throughput have improved, and the average revenue per days have improved as a result, again, of increasing complexity in the services of the Congo procedures and specialties that was carried out by Siloam. Moving on to throughput. Throughput have also seen consistent quarter-on-quarter improvement. Inpatient admissions improved by 25.6% compared to FY22. Inpatient by 15.5. Inpatient days by 15.5, sorry, and the average length of stay decreased from 3.3 days to 3.1 days. Occupancy rate has improved 10.7% to 65.2% blended across the board. And outpatient visits have also improved by 23%. And OPD to IPD conversions, as you can see, has similarly improved from 2.9% in FY22 to 3.1% in FY23. In addition to improvement in throughput, again, driven by both the flagship and also our new hospitals, we also see that the payer mix in terms of private PBGS has maintained compared to the year before. You will see that the BBGS mix has maintained at around 18% mark, whilst the non-BBGS mix is around 81.6%. In addition to improving revenue intensity, through maximizing throughput and complexities and payer mix, we have also been relentless in the drive to look at how we can improve the efficiency of the services that we provide to our patients. As you can see on the chart here, drug and clinical supplies as a percentage of revenue has decreased from 35.1% pre-COVID in 4Q19 down to 28%. Operating expenses have similarly decreased from 36.1% in the pre-COVID performances down to 31.9%. You would see a slight spike from 4Q23 to 3Q23. That is largely because we onboard our nurses in the last quarter of the year. So as a common pattern that there will usually be an increase in the 4Q due to such onboarding. Regardless, you will see that EBITDA margins, we were able to maintain that above 30%. I think that was the target that we set for ourselves to be able to surpass the EBITDA margins that we were able to achieve during COVID days. And I think we have more than achieved that, being able to maintain in the last two quarters an EBITDA margins that is above 30%. And I do believe that this trend will continue because a lot of the efficiency measures and drive that we have achieved in the past are initiatives that are sustainable, including how we have reorganized the way we look at drugs and consumables and the way we look at the negotiations. Net profit margins similarly has improved from 3.2% in 4Q19 to about 15.9% in 4Q23. The range of initiative that the management carries out in the Siloam is wide and varied. We look at potential savings through the way we procure. We look at potential savings through looking at potentials for savings on shrinkages, revenue leakages, the way we conduct testings, and all in all, through the negotiations that have recently been conducted in regard to the savings over equipments and contract services and drugs and consumables, we estimate that this will bring over 840B in savings, which allows us to invest more of that savings back into providing improved medical services to our patients. Operational cash flow, similarly, we have been diligent in trying to manage and optimize the use of funds within the hospitals. As you can see, working capital days currently sit at 4 days in 4Q23, one of the lowest that we've achieved in the past. This is reflected through the improvement in operating cash flow from 1.688 trillion to about 2 trillion in FY23. So with the kind of operating cash flow that we are now generating, Carol will talk to you later on about some of the exciting programs that we have in terms of expanding our bed capacities, our services, and so forth. But one of the areas that we have invested heavily is to improve our digital capabilities. As you well know, Siloam was one of the first hospitals within niches to be able to achieve the implementations of an end-to-end integrated hospital information system. This led to improved doctors' performance, shorter waiting time, and improves patients' experience. Siloam has also successfully rolled out its electronic medical record systems. Currently, this has over 97% adoption rate, and this also allows us to provide more consistent services to our patients, no matter which Siloam hospitals they go to. You will see that the prioritizations of patient experience is critical. Yeah, the implementation of SOFAs that Varun has explained to all of you in previous earnings calls have resulted in 80% of complaints being able to be resolved within 2 hours. Yeah. And this has led to various improvement in the patient experience, including various scorecards that we are keeping track of in regard to both Google scoring and other assessments in tracking customers' experience. Patients booking through digital channels currently sits at over 800,000 bookings, but through our digital portals. And 21% of our outpatients now are carried out through a digitized channels. And we do believe that this digital channel will continue to grow as we continue to invest in improvement of our capabilities through both our website, My Siloam app, and other services that we provide. And we are excited by this because the digital transformations allow us to reach even more patients than we could before with just our brick and mortar hospitals that we currently operate. The My Siloam app has continued to evolve. For those of you that haven't tried it and downloaded, I would encourage you to at least give it a go, give it a try. But the improvement is significant. You're now able to book doctor's appointment, manage the appointment online, book checkup. You'll be able to see your medical records. You'll be able to see what drugs has been prescribed, along with being able to do teleconsult, telechat through our app as well. And I think as a result of all these investments in digital technology, including on-site, for those of you who have visited recently, our single queue system, patients' waiting time has reduced by over 27% if we were to compare 4Q23 to 1Q23. And this basically, we also, if you can see, as a result of the improvement on patients, the adoption rates among our patients are also improving. Engagement rate now is at over 78%. The app has been downloaded more than 2.5 billion times, and there's more than 12 million website traffic that's generated per month. And consistently, the Siloam app is rated as one of the top healthcare app in Google and Apple. And we do see that the user friendliness of the apps, along with its functionalities, is driving more and more of our patients to adopt it as one of the way of providing a seamless experience to our patients. We are also very happy that the transformations, the digital transformation that have been carried out, have been widely recognized. Siloam has received the Recognition of Excellence Award from the Open Gulf of Asia. This is a regional award to recognize our contributions and development through the My Siloam app. And we've also just recently received ISO 27001 certifications for our data quality and management. So that is an overview in regard to finance and operations. I'll pass the time over to our CEO, Caroline Riady, to give you more business updates. Over to you, Karen.
Hi, thank you, Daniel. Good afternoon, everybody. Thank you so much for joining us out of your busy schedules. I hope that everybody has had a chance to look through our numbers and our deck. What I wanted to share is that 2023 has been an incredible year. I couldn't be prouder of the team, and I couldn't be more appreciative of all the support that we have received from all our stakeholders, such as yourself, and also the trust that we have been given by patients and families as they trust us to treat their loved ones. I think Daniel has given some highlights on the volume, but we had questions on how our revenue is growing, and we see that we are growing in terms of volume, and we are growing in terms of revenue intensity. So this is a very sustainable growth. And in 2023, we did 4 million outpatient consults, and that is a growth of over 20% to the previous year. Same also to the inpatients and the surgeries and the medical checkups that we have done, that has grown over 20%. This again is reflective of the trust that the public has given to Siloam. We also have done more than 8 million lab tests, radiology tests, and diagnostic procedures as well. And therefore, we know that patients are accessing more acute services with us and not just outpatient consultations. With this volume growth and with the improvements that we have and with the systems that we have implemented in our inpatient, outpatient, and other lines of businesses, we have grown our Net Promoter Score to 70. This Net Promoter Score of 70 has been validated by external bodies, and compared to other players in the healthcare industry, 70 Net Promoter Score is a very good place to be. We also continue to benchmark for brand recognition and brand equity, and our brand recognition and brand equity is the highest level that it has ever been. And every year we aspire to serve more patients. 2023 performance is not a one-off. We get this question every quarter, and I think maybe it's because every quarter, every year, we have new highs, we have record performances. And so we understand that all of you are wanting to know whether this performance is going to be sustainable. Now, during COVID, the question was, oh, is it a one-off? Maybe it's COVID revenues. And we said, yes, there is a lot of COVID revenue, but even when the COVID revenues went away, we saw an upside in our revenues, in our performance. And we again got questions on whether this is a one-off. And we said it is not a one-off. It's not because people are coming out because of a pent-up demand. And again, in 2023, we saw record performance. And again, I'm here to share with all of you that it is not a one-off, and is not the work of a single person, but it is the result of a team effort in delivering our Siloam 5.0 5-year strategy that we started in 2019 with pillars in core growth, network expansion, clinical programs, and digital health. I know Daniel has gone through a few. I'd like to provide a few highlights. So the reason behind a lot of the growth is not just because of volume, but because as promised, as previously promised, we continue to invest in and grow our clinical capabilities. And we are committed to making sure that there are more and more healthcare services that the Indonesian public will be able to access in Indonesia. Daniel mentioned Congo, and we have continued to double down focus on Congo plus transplant. In oncology specifically, we are honored that in 2023, we were named one of Newsweek's top specialist centers in Asia Pacific. We ranked number 63, and this is above a lot of the competitions outside the country. And so we're particularly proud of that and proud of what the teams have been able to do to get us to that point. A few other highlights in oncology. We have installed a second PET scan at MRCC. This is the 4th PET scan only in the country. So there are 4 PET scans in the country. 2 are in the Siloam network in MRCCC, and we have installed it and will be operational in April. We have also commissioned the state-of-the-art immunocompromised isolation room that allows for aggressive chemo procedures, but also bone marrow transplant for multiple myeloma, which we have already started. So this is an example of how every year we want to raise the bar in clinical offerings in our network. We've also commissioned the Gastrointestinal Cancer Center. We know that colon cancer is a top 5 cancer, and therefore, again, like we did with breast, bringing together a multidisciplinary team of experts to focus on gastrointestinal cancers along the whole continuum of care, from screening to diagnostics, curative, rehabilitative, and palliative. We've also launched our gynecology center as well, doing the same thing as the gastrointestinal center and the breast. We are also expanding our LINAC network, as we have also shared with some of you over the past few quarters. We have added another LINAC in our network, which is in Siloam Agora, and we are on track to start radiotherapy services in Lippo Village, Makassar, Surabaya. Now, we're very excited about these radiotherapy centers because these are places where we already have a very strong patient base and we already have a very strong talent base. So equipping these centers with radiotherapy will mean that patients will be able to access radiotherapy closer to their homes, and doctors will also be able to do more for our patients in those centers. Cardiology and neurology. We are putting our hospitals through a program to make sure they are stroke ready. It is a third party. I think there's a slide for this, right, Willie? It is a external third party certification given by an organization called Angels. And we have 3 hospitals that are stroke ready hospitals. And we are going to be ramping that up to 24 hospitals this year. So 24 out of the 41 will be stroke-ready hospitals certified, which will make us the largest stroke-ready network in Indonesia. We continue to progress with our kidney transplants. We have done over 300 procedures this year. And we are so proud that not only are we doing more transplants, but we are benchmarking globally, and we are seeing that our survival rates and our 1-year survival rate and our 1-year graft survival rates are above international best practices. We also continue to grow our IVF. We have more than 770 cycles that we have done, 460 pregnancies, 260 take-home babies, and a 64% pregnancy rate compared to the global best of 30 to 45%. So this is well above the global standard. So as we are growing our clinical programs, we're not just making them available, but we are ramping up each of these programs. And we are also showing that we are providing international level care. We have a few highlights for expansion of our network. We have continued to expand. We continue our expansion strategy of opening 1 to 2 hospitals a year, while obviously optimizing our existing assets. Therefore, our expansion is really a nice mix between new sites and hospitals that are doing very well and are in need of capacity. As of full year 2023, we operated close to 4,000 beds with an occupancy of 66% on a blended basis. That being said, we still want to continue to grow. We've been reporting our pipeline projects to the market. First, we'll soon be opening the first oncology center in Banten that I mentioned, which will be located next to Siloam Lippo Village. This center will be fully equipped with LINAC and also a PET scan. and we have the talent and the patient base in order to make the most use of the center. We have started and will complete the expansion of Siloam Makassar this year, and we'll start using the extension operational by Q2, and the oncology center again by the end of this year. Now, every single oncology center that we open in Indonesia will come under the name of MRCCC, because we believe that MRCCC is not a place, it is a movement. It is a commitment of the group of Siloam for us to advance and open up access for oncology care in Indonesia. So we'll have the MRCCC opening in Lippo Village very soon, and also in Siloam Makassar and the new extension that we're going to be commissioning. We have finally topped off for our new Surabaya building in Gubeng. This is an extension to the existing building, which we were operating at 12,000 square meter, which is very small for the productivity that it has and the revenue that it has. And so we're very excited that we will have a state-of-the-art building where we can support our specialists. And this is going to be operational by Q4 of 2024. We have also completed the acquisition of adjacent land to our Siloam Asri, which will serve as the expansion of our uronephrology center to allow for more transplant. We are coming close to the capacity limit for that building where we do transplants, and therefore we are going to be extending this facility. Everything that we do in Siloam is possible because the team that we have. Of more than 13,000 full-time employees, 700 GPs, and 3,000 specialist doctor partners. This is the reason that we are able to do what we do, and we are able to grow the way that we grow, and we're able to provide the services and maintain the service levels that we have. So we have continued to recruit, retain, and develop the best talent that we can find. And we are pleased to share that our voluntary employee turnover in 2023 is 8.5%. And the specialist doctor turnover rate is less than 5% in 2023. Compared to a 5.9% in 2022. What does this mean? This means that we are able to retain our talent in a market that is scarce of talent, and where other hospital groups are looking to Siloam as a source of talent. But because of the talent retention programs, the development that we are doing, and the vision that we have, the culture that we have built in our organization, we are able to recruit the talent, which is key to us delivering our strategy. We also do quite a lot in developing our talent. And last year, we spent over 500,000 training hours on our staff, which converts to 42 training hours per employee, which many of you know is quite a lot. We do training in technical skills as well as soft skills and leadership skills as well for all our employees. ESG activities, I would like to give a few highlights. By building a profitable and sustainable business, we benefit all stakeholders, from investors, patients, and communities throughout the country. And as our business grows, we're able to impact more communities, and we're incredibly proud to play a role in developing the country's healthcare infrastructure so we can look forward to a healthier and more prosperous Indonesia. Now, we've been doing all of this, and we've been measuring and reporting to all of you, but we want to do this in a more systematic way, and we want to bring it to the next level. So over the past 2 to 3 years, we've linked all the indicators we've collected, and we will be collecting in the future. So number one, we are going to be preparing an ESG framework that will be ready within the next quarter, and we'll be ready to share this in the coming quarters. And we will, this includes how we will be setting targets and measuring progress and aligning the whole organization to our sustainability framework. We will continue to benchmark externally, and later this year, we will also be announcing decarbonization targets as well. Now, in the area of ESG, we continue our work and our support in Papua, which is an underserved community in the east of Indonesia. We are present in 7 villages where we provide free healthcare to more than 10,000 patients annually. This is continued in 2023 and providing general healthcare, stunting prevention, medical checkup, home education awareness, pediatrics immunization, and so forth and so forth. We have also started an ESG project in 2023 that we called Selangkah. Selangkah is a project, Selangkah stands for Semangat Lawan Kanker. So it's a cancer awareness and screening program where we have chosen to focus on breast cancer screening. Why breast cancer screening? Because we do a lot of breast cancer cases, and we do see a lot of patients coming to us in the later stages. And we know that when patients are diagnosed in later stages, the prognosis is quite poor. And so we are doing our part to make sure that patients are detected earlier in the journey, and so the outcomes are better. We set a target for ourselves of 25,000 participants. We wanted to screen 25,000 women in 2023. We are pleased that over 200 groups have donated to this program, which has allowed us to adopt over 70 villages for this program. 26 women have been covered, 11,000 women have been screened, and the remainder are working through the screening journey. And we've also done over 45,000, so we have done health talks reaching over 45,000 participants in the education and the health talks that we have done. And continuing the spirit and success of the program, we've extended the program to 2024 with a target of 50,000 women across Indonesia through 14 hospitals. So this is very positive. We've been talking a lot about our 5-year strategy of Siloam 5.0, which we started in 2019. So therefore, consequently, 2024, we started in 2019. So consequently, 2024 will be the last year of our 5-year strategy. And this is a strategy that has brought us to where we are because we had a clear objective. We had cascaded it throughout the whole organization, and we are deliberate in executing our Siloam 5.0 strategy. So the question is now, from all of you, probably, what next? What I have to say is that Siloam is in the right place, in the right time, in the right market to take advantage of the growth opportunity in Indonesia, especially as the government looks forward to Indonesia Emas 2030, where people development will be a huge part of the government agenda. There's so many opportunities for growth in healthcare, but especially in Siloam, sitting in the position where we are. But for me and my management team, the most important is for us to be focused on what are the best opportunities for Siloam. We will be announcing a 5-year strategy in the next few quarters, probably towards the end of this year. But we have already started preparing for 2 projects that will be a huge part of our next 5-year strategy. The first project that will be a huge part of our next 5-year strategy is a project that we call the Archetype Project. Now, some of you are aware that we are changing the categorization of our hospitals from maturity level of the hospital to market segmentation. The Archetype Project is a product differentiation project where we will optimize each of the hospitals based on the patient segmentation in Indonesia, premium, value seeker, and BPJS, and make sure that our offerings are tailored to the markets where we serve. By doing so, we believe that this will strengthen our brand, it will strengthen our patient experience, and it will strengthen the business model of each of our archetypes as well. And we will be able to take the most advantage of the opportunities in each of these market segments. The second one is a diagnostics project that we are working on. We will explain a little bit more on this, but we always focus on clinical programs. But clinical programs can only be as good as the supporting services. Now, diagnostics is a huge supporting service. It is also a huge source of revenue for Siloam and has more opportunity for us to grow. So these are the two projects. We will be sharing more about our next 5-year strategy in the following earnings calls to come. Last, at this time, I would also like to take the opportunity to make an announcement and thank my colleague, Mr. Varun Khanna, who has served as my Chief Commercial Officer and subsequently Healthcare Business Investments Managing Director for the past 5 years. Varun has been played a significant role in my management team and has interacted with many of you. He has helped us to realize a lot of the growth opportunities and build the capabilities and team in Siloam. He has returned back to India to support her with some health issues. While we are sad to see him leave, we know that family comes first, and we are thankful that we have benefited from his time in Indonesia. And I wanted to share with you that our team remains strong, with many young talent coming up the ranks over the past few years, and the way the team has grown and solidified. And so without further ado, I'm going to pass the mic to Varun to say a few words before we pass it back to Willie. Thank you.
Thank you so much, Carol, for the nice words as well. So let me start by thanking all investors and partners for all the support that we've had through these years. You know, the last 5 years have seen Siloam deliver the highest total shareholder return amongst all regional players. And mind you, I'm not talking about just the Indonesian players. If you look at the entire region, the total shareholder return has probably been the best. It's been an incredible journey, and I think I'm going to take some points off from Carol and Daniel, which is focused on 4 things. One is clinical programs and focused patient outcomes, leading to a very significant volume-led growth in 2023. The second is investment in medical equipment, and this is to enhance and broad-base the clinical programs across Indonesia. And this is, you know, again, a very conscious one for Siloam. We've not only focused on Jakarta, but we are one provider which has been focused on delivering care, high-quality care across Indonesia. I think as Daniel and Carol both mentioned, digital patient channels. This is the most integrated interaction channel that you will find in Indonesia. And sometimes when I compare it to global peers, it is one of the best that's available in the world. I think the fourth point is really the key to sustaining everything that we do is the investment in talent. And today we have a much stronger talent base in the company. All this happened in a very planned way. And today, less and less people travel, especially for three things, which is cancer, neuro, and cardio. And this is all sustainable as we have built an ecosystem. As you've seen globally, it's very difficult to build successful and profitable healthcare models. But once you get it right, it takes less to continue. And this then leaves more management, the management with more bandwidth to be able to look beyond the core business. And I think that's where Carol just alluded to the next 5-year strategy, which will be shared over the next 2 to 3 quarters. As I move on, we've had a very planned handover process for a while. And given how we have been able to develop talent, I can assure you the growth journey is in very, very capable hands. I'm very confident that as we go forward and with the thinking that's been put in place for the next 5 years, as mentioned by Carol, Siloam will continue to grow profitably, better than its regional players. I continue to be a big promoter of Siloam. Once again, thank you so much. And Willie, back to you.
Thank you very much, Pak Varun. We all wish you good luck and all the best for your future. And now we'll open the floor for Q&A. I would like to remind all participants who want to ask a question, please use the Q&A function in your Zoom screen. We do have one question from Raihan Rafli asking about, is there any guidance for 2024? Daniel, over to you.
I think high level, you should expect low to mid double-digit revenue growth. EBITDA margin will certainly maintain above 30%. We still have initiative to continue to improve it. So I should see, but we should see improvement, but at least we should maintain above 30% EBITDA margin.
Yeah. Thank you, Daniel. Also, another question from Benjamin Ang. How will the omnibus law affect the healthcare industry in Indonesia and for Siloam? And is there any plan to open hospital in the new capital of IKN?
I'll take that one. So how will the omnibus law affect the healthcare industry in Indonesia? Very favorably. And when that happens, we are in the best position to take advantage of the changes that are going to happen. So just a little bit of a recap, the revision of the healthcare laws has already happened. And now we're waiting for the revision of the laws subsequent to that. And so that we expect in the next 6 months. And how will it affect Siloam? We will be in the best place to take advantage of that, because suddenly there will be many new opportunities open to us. If you have any questions related specifically to any of those areas, happy to explain, but we will continue to give updates in each of our earnings calls. Plans to open a hospital in Nusantara, I think at the right opportunity, at the right time, in the right location, then yes. Currently, the Nusantara market is growing. There are a few hospitals there. We don't believe that it is a market currently for more hospitals, but we are already very close to IKN because we have a large operations with much more sophisticated clinical offerings in Balikpapan. Now, with the new toll road, it'll be 30 to 60 minutes. And so we see that a lot of the complex cases from IKN for a while will be referred to Siloam Balikpapan. And then at the right time, when the population grows, then we can think about another hospital in IKN. But right now, we have it covered through Balikpapan.
Okay, thank you very much, Carol. We have another question from Ingrid. OPD is declining the average revenue per visit. When will it bottom, and what is the reason? Daniel, over to you.
OPD in terms of, sorry, which you're referring to the Y on Y? Well, if you look at the OPD, obviously during COVID seasons, the average revenue will be higher due to the various COVID-related testing results affecting the average revenue. So after we are going out from COVID, I think what you're seeing here is probably a more stable state as it is right now. Sorry, do you want me to go to the other questions on here?
Oh, yes, please, Pak.
Price increase for 2024 is about 3%. The new beds and hospitals, well, we're looking at basically growing about 10% of beds every year. And the hospitals, we haven't changed. I mean, looking at 1 or 2 hospitals, but I think more importantly is to look at the number of beds grow per year. I think that's probably a more important matrix because a lot of expansions we are working on currently right now. I mean, for example, Carol already mentioned in the Makassar, that is also, for example, related to our current hospitals. They're doing well. We have various works in other hospitals in LV, KJ. I think those are actually also very important. The guidance of financials, I spoke about CapEx, probably about 1.5 to 2 trillion in terms of the expectations for CapEx for 2024. Can the payer mix be further improved? I think we gotta be careful in kind of phrasing what we mean by improving payer mix. We certainly continuing to improve our share of wallet for both corporate and insurance clients. As you can see from the slide that's been presented quarter-on-quarter, year-on-year, the corporate insurance throughput continue to goes up along with the average revenue from those patients. But at the same time, it doesn't mean that we are neglecting BPJS. I mean, BPJS are seeing growth as well, but we are seeing obviously that the growth in corporate insurance is higher than the growth in BPJS, and we do expect this trend to continue as more of our hospitals matures. But I don't think we should look at this as there's an optimal numbers of payer mix. Internally, certainly that's not how we look at things. Marketing spend and so forth, we did increase it in 4Q23, and I think the way we are managing expenses and so forth, and I think this is probably in line with how what US investors are communicated to us in the past, is that look, we try to manage our expenses diligently throughout the year, and then when we look at towards 4Q, depending on the financial results, we do notice that there are extra spend that we can allocate and to some of these items. Marketing spend, due to the number of clinical programs that we're launching, we do believe that it is the opportune time to basically increase our marketing spend. When we even compare to our peers, we do believe that marketing spend is under what the industry has been spending. So in 4Q23, we took advantage of this and we stepped that up. Rental gets adjusted in October every year. So in the last quarter of the year, you will also always see a increase in rental. Professional fees, I think as Caroline has alluded to, we are now embarking on what we call the next generation Siloam, which is our next phase of strategies. We are engaging consultants to help us review, looking at how we should organize our archetype, and basically looking at adjacent businesses as well, which we will share with you in time to come. So that has resulted in some increases in expenses in 4Q23. Jan and Feb, I am happy to report that we are seeing that the trend that we are seeing in terms of Q-on-Q improvement that I spoke about is continuing into January and February. Again, I can't give too much specifics at this stage. Well, it's going to be a month only. Next month, I'll see all of you again. I'll talk about the 1Q performances. I think when you see 1Q performances, you would again, some of the wording I'll be using in that meeting will be, consistent performances as what I've said during this FY23's presentations.
Okay. Thank you very much, Pak Farun. We have another question from Ari Jasha. Number one, can you please share color on year-to-date trajectory along with the key drivers on revenue growth targets? Is it going to be volume or revenue intensity? And number two, what could be the next levers on EBITDA margin uptick after expanding to a record height of 31%?
Yeah, let me take that. I think the color for Jan Fab I've spoke about earlier. And I think at the end of the day, the three drivers will continue to be there. I mean, the throughput, the improvement in ARPOB, as you can see in FY23, both those matrices have improved compared to the year before. and I use back the same word that I've used earlier, we are going to make sure that these performances are consistent in regard to a quarter-on-quarter improvement. In regard to EBITDA margin, there's, I'm happy to say we've done a lot, but we do see that there's still a lot that could still be done in bringing that EBITDA margin uplift. I mean, for example, currently we have a project going on just to look at the revenue leakages, to look at aspects of our chargings, whereby there are certain services which are not fully charged or allocated to patients. So we have projects going through that. We have another project basically just combing through our OPEX and looking at how we can improve productivity. I mean, a lot of that is also tied to our ESG initiative in looking at how we can have more efficient use of energies. So I would say there are actually still quite a lot of levers that currently management is working on to continue to improve its EBITDA margin. Not to mention, obviously, as case complexity improves, as some of our what we call previously called ramping our hospitals, I mean, get more mature right now. But the EBITDA margin uplift will be there as well. So we are confident that there are various ways to both sustain and improve on the EBITDA margins that we are already making.
Thank you very much, Pak Daniel. I think we have some more time to answer one or two questions. We have a question from Sabrina. How much is the coordination of benefit revenue contribution as of 2023 and compared to last year? Thank you.
I don't think we released that number specifically, so I've got to be
I think that we do monitor it. It's not a number that we release, but at this point it's not material. We are watching the COB because we don't want companies to drop from fully corporate to COB. But if there are companies that are using full BPJS that can be upgraded to a COB, then that is a gain for us. So we do monitor this internally, but we don't release those numbers. But it actually, at this point in time, is not material. Our priority is more to retain corporates and insurances in the category that they are, rather than trying to grow it as fast as we can and dropping profitability by them moving categories.
Okay. Thank you very much, Pak Daniel, Bu Carol. One last question, maybe. Pak Bu, do you plan to buy back more of Siloam hospitals this year?
Yes, we definitely do want to buy back hospitals, but is it this year? Is it next year? I think this depends on a few things. It depends on our cash flow, depends on also the valuation of those hospitals, and also what's going on the First REIT side as well. But do we have intent to buy back? Yeah, of course, we are looking for an opportunity to be able to do so. But I don't mind answering a few of these. I think those are good. These are good questions by Benjamin Ang on the challenges of the omnibus law, and this is clarified a little bit more on new entrants. Now, I think that it's not that when the market opens, there's going to be a swarm of doctors coming in, or when the market opens, then when regulations open, then there's going to be a swarm of new investors. I think that there are entry barriers into the Indonesian market that are not just related to the regulation. I think that we have a strategic positioning in the brand that we have established, but also the ecosystem that we have built. So let's say some foreign hospital would like to set up shop in Indonesia. They would go against the same challenges that we do on, let's say, hiring doctors. And let's say you say that, okay, well, they can bring doctors from overseas. Okay, they can bring doctors from overseas, but you would need the nursing capabilities in order for those doctors to be able to practice what they usually practice overseas. Now, then you would say, okay, then we would bring nurses from overseas. But if you do all of that also, then what segment are you going to be serving? And even in the premium segment, it may not support the cost structure that you will then have. So that's why it's also not so easy. And also a lot of these businesses are referral businesses. So a lot of the business that gets referred to MRCC is being referred to others from other cities by other doctors. Now, these are some of the things that are not so easily disrupted. Now, however, if we do get a foreign doctor in MRCC, that is a very different situation because we have our infrastructure, we have the referral system, we have our ecosystem, and so we will benefit from it the most. Will there be an upward pressure of wages for nurses and doctors? I think that for nurses, we do follow pretty much the increase of the minimum wage. The nurses are not at minimum wage, but as the minimum wage increases, then the nursing wage increases. And of course, the higher up the nurses, then that wage increases as well. So I don't think that that is going to drive the wage increase for nurses. Now, doctors, on the other hand, are already at a near maximum level. Now, what is going to drive the upward pressure of wages for doctors, and we're talking specialist doctors, is the scarcity of doctors in Indonesia. That is going to drive it. So now if you then open up the market and there are more doctors, then it lessens pressure on the limited number of doctors that are in Indonesia. So I hope that answers your question. I really wanted to quickly also answer the question on insurances. It has been a question that we are receiving. Yes, there is pressure from insurances because they have to transform to be in a position where they're a little bit more sustainable. So obviously it puts pressure on hospitals. But I think that bear in mind that this is not the first time that there are changes within the pair that we've adjusted to. We've lived through the changes of BPJS. We've lived through the changes of managed care, more specifically in health, and we've worked with our peers because we have to work with the partners in our ecosystem to grow this ecosystem. So if the insurances are suffering and they're not sustainable, then we're not going to be sustainable as well. So we are working with each of them so that everybody's in a better position. Now, what I would like to say is that because of our positioning and because of the clinical offerings that we have that is unique, and because the weight of our brand, there is a lot of pressure for insurances to keep Siloam open with the arrangement that currently is. And so with all this pressure, we've been able to keep the discounting increase to a minimum. In fact, we have not increased discounts for insurances given this pressure. They recognize that there is a unique value proposition that Siloam brings, and therefore they are also more open to discussing with Siloam what the win-win situation is to be. And we continue our corporate and insurance volumes and revenues continue to grow year on year.
Okay, thank you very much, Bu Carol. I think we're because of time, I think we can conclude the call now. So again, thank you very much, Bu Carol, Pak Daniel, and Pak Farun. That concludes our call for today. And thank you for all participants who joined the call. If you have any follow-up questions, please reach out to me anytime. And have a good day, everyone. We'll see you on the next webinar. Take care.
Thanks, Willie. Thanks, everybody.
Thank you.
Everyone.
Thank you, everyone.
Thank you,
Bye-bye.
Barry.